is an inflammatory disease in which the nerve cells in your brain and spinal cord are damaged. It's chronic and completely unpredictable. MS is thought of to be an anti-immune disorder, meaning it causes your immune system to attack your body's healthy tissue rather than the infected tissue. Most people who are diagnosed are between the ages of 20 and 50, but some as young as 2 and as old as 75 have it as well. More than 2.3 million people are affected by it worldwide. As I said, it's completely unpredictable, meaning practically anyone can get this disease. It seems to get down to genetics. Not to scare you girls, but more than twice as many women as men have MS. MS damages your nervous system to your brain, optic nerves, and spinal cord. It also affects your immune system to target your healthy tissue instead of the infected tissue. These immune system attacks damage your myelin, the protective insulation surrounding your nervous system. Bit confusing, yeah? Just think of myelin as the material around an electric wire. If this material is damaged, it messes with the transmission. The only difference with myelin is this transmission is actually your body's nervous system. Instead of cords, its symptoms vary from person to person, and as I said, it's completely random. Some symptoms may include abnormal fatigue and feeling numbness and tingling, but it varies from person to person. Others could have loss of balance and muscle coordination, and even have difficulty walking. Other people could even have slurred speech, tremors, stiffness, and bladder problems. It depends on the severity and how long the symptoms last. In rare cases, MS is terminal, but it is known to shorten lifespan. The majority, about 2/3 of people who have MS, remain able to walk, but will need an aid, such as a cane, or crutches, scooters, or wheelchairs, due to fatigue, weakness, balance problems, or just help conserve energy. MS is not contagious and can't be directly inherited, although it seems to get down to genetics in the end. Sadly, we haven't found a cure yet, but there are medications that can help modify or slow down its course, or even bring it back to its earlier stages. Thankfully, there are very many charities that are helping to find a cure for MS, and I think that we're getting closer every year. Although there is no cure, there are very many treatment regimens that focus on managing the symptoms and attacks of MS. These include corticosteroids, plasma exchange, physical therapy, muscle relaxants, medication to reduce fatigue, medication to combat depression, pain, and bladder and/or bowel control problems. Here's some more facts I found. Again, here's just a quick revision of all the stuff I covered in this video. That's the end of my presentation. Thank you so much for watching, and I hope I helped you learn a lot more about MS.